is I guess I'll get started by asking, during my research, I've been seeing different thoughts from healthcare workers, some thoughts being that it's right to end the restrictions, and others saying that it is dangerous and, especially in Quebec, could collapse our healthcare system. What are your thoughts on this and reopening specifically?
Sure. So, obviously, I think that restrictions were intended as a temporary measure while we, found effective treatment or effective vaccines and that sort of thing. I don't think that they were initially intended by most people anyway, or no one imagined that they would go on for 2 years or more. So 2 years later, what we have are vaccines that work pretty well in that they reduce at least the severity of disease, but they're not perfect. They don't seem to prevent a lot of transmission. So we still see a lot of people with, symptomatic illness, quite, again, anecdotally, quite sick, but usually not hospitalized. The people who are hospitalized, at least disproportionately, are people who are not fully vaccinated, or there are people who are, still either elderly or have significant other illnesses. So they continue to be hospitalized and end up in the ICU and, frankly, sometimes die. But these are people who are maybe transplant, have had a transplant organ transplant, or they have kidney failure, or, they're people with pretty serious medical problems. I think that for the vast majority of the general public, if they can get vaccinated, they're, pretty safe. It's not perfect. There's a risk to be taken maybe, but I think that at this point, it's kind of, how long are you going to go that the government imposes, it's not sort of our society. So, so I think that's where we're at. We're at a situation where if people don't choose to get vaccinated, I think they're fools, and they're going to end up, really suffering over the next year or two until if this thing ever goes away completely, which I'm beginning to think it never will. So, people who don't get vaccinated, they're especially older people. It's hard to put kind of a limit on that, but above 40, they're taking a serious risk in terms of their lives. And they're the ones who will end up in the hospitals and burdening the healthcare system and so on. Okay. It's the people who do get vaccinated and take every measure but have serious medical problems or are, really, elderly, over 80. For them, when you lift all the restrictions, I think they're the ones who are going to have also a pretty restricted life. Because now, yes, most of us can choose to go back to a more normal life, and we take a risk on getting sick with COVID, but it's like getting sick with influenza or common cold. Okay, it happens. But, are you going to live your whole life just to avoid, kind of a relatively mild illness? Probably not. I think most people would choose to live their lives. But for the people who are at risk of severe illness despite being vaccinated, I think for them, that's where their lives are irrevocably altered. And when you lift all the restrictions, it is that group of people that we are, maybe people aren't thinking about it, but it's their grandmother that is going to be really shut off from the world. And I don't think, there's been much discussion on that point. And that's kind of what the government is lifting restrictions because the majority of people want that. And they want to win the provincial election. But what no one is talking about is how to adequately protect the most vulnerable who have done everything possible, meaning they're fully vaccinated, to protect themselves. They can't do anything else, and they're still not protected.
Do you think during the lifting of these restrictions, is there anything that can be done to support this community more?
Right. So that's where you get back to testing, because all that we have really, I mean, we don't have very effective treatment. Once you get sick, we don't have very good treatment still. I mean, there are some drugs, and maybe there'll be some developed yet, but so far I haven't seen any real miracle drug that really, it's not like HIV where we've seen, really effective treatment. So not yet anyway. So until then, it's a question of can we protect them better by testing better? Because I think that was actually your initial question to me. What about, rapid tests and so on? So I think we don't have a testing strategy that controls the epidemic. We have a testing strategy that, it sort of helps identify people when they have symptoms, but by then they've often transmitted to others, and we know just looking at the epidemic that the testing strategy doesn't work. The current testing strategy. So is that because it's not an accurate enough test? I think that's part of it. You take a test that misses a lot of asymptomatic people that we know are part of the transmission chain in many circumstances. So you take a test that doesn't detect them at all, or detects them poorly, or detects people who have symptoms even late. So we've had symptomatic people that are negative on day one, and as they get sicker, they become positive with these rapid tests. So we know that rapid tests are not really a solution for transmission. It's not going to stop transmission. Whether the more accurate tests that are more sensitive can stop transmission is, a bit debatable, hasn't really been tried, because you need to do a lot of testing. You need to test a lot of people to really stop transmission. So that's it. So we haven't, again, that's kind of been abandoned as, too expensive, not feasible. I'm not sure it's ever really been tried. Maybe in Australia where they have very strict quarantine and they do a lot of testing. They've been able to kind of control things by really testing everybody in sight, right? Because if you come in contact with 20 people, you have to test all 20. You can't wait for symptoms to develop and transmission to have occurred, because then you have 100. So you have to find those 20 and test them, which is a lot of work. So no one in Canada has tried that really. It's not been part of the equation. As far as I can see, it's the only other method that we have at our disposal. It's the only technology we have at our disposal at the moment. Honestly, I don't know if it would work. It just hasn't been tried. It hasn't been discussed. It hasn't been seriously considered. It's been dismissed by some without thinking. So the move to rapid testing from PCR-based testing has been kind of an admission that testing, people have given up on testing as a way to control the epidemic.
This is kind of in connection, but, with the government removing PCR testing, and I guess it's kind of up to people whether they want to report their positives at home. Mm-hmm. Does it prevent us from having an accurate understanding of just how many positive cases there are in Quebec and in Montreal?
Of course. Because you're not obliged to report. I've never, I've not personally had a positive test. So, in fact, I've not even done a rapid test, fortunately, so far. So I don't know how easy it is to report your results. I know that quite a few people do report. But, it takes a certain, it takes a certain motivation to report, right? There's no gain. There's nothing to be gained from it individually. So it does require quite a collective sense of, what's right for the community to report these positive tests. So I would guess there's very substantial underreporting, and so if they say there's 1,000 cases per day in Quebec and 5,000 in Ontario, I think that part of the difference might be just reporting.
Are there any other resources do you think that the government should provide Quebecers as, we approach the next wave and I guess move towards the lifting of the mask mandate?
It's hard to say what they should do in the absence of good and clear information. I mean, I'm a researcher, so naturally I think that they should do more research to understand better, if you want to know how to protect people, I mean, surely you should, and we're not actually sure. I don't think I would defy anybody in the government to really give me a clear rationale for, why they're removing all these mandates as, we see more cases now, certainly than we did in the first wave or the second wave, when all these mandates were clamped down. We're still at well over 1,000 a day, and I must say anecdotally, I know more people personally who've had COVID or are having COVID now than ever before. So at least on a personal level, I kind of think the epidemic is not going in the right direction. Although, a lot of that's related to school openings and, people getting it from their kids and all this other stuff. So, it's all very well to remove the mandates and let people get back to their normal life, but I think that they should be really investing in more serious, careful inquiry as to really what's going on, who's transmitting, who's at risk, how much are people who've had 3 doses of the vaccine at risk, is a 4th dose, necessary, et cetera, et cetera. When do we need our next dose? Needs to be a coordinated effort. And maybe some alternative. I mean, I think of these nursing home people and elderly and people with severe medical problems. They're going to be prisoners. No one is talking about that.
Thank you so much. I just have one last question, if that's okay. With the healthcare system that's been described as collapsing, can it handle not only another wave, but one with people where there's no enforcement of masks and other restrictions such as distancing and things like this being removed?
Yeah, I mean it's that too is difficult. You look at the numbers, and where numbers of hospitalized in ICU are down, which again I think is largely a reflection of vaccination more than any other event. But we're still in first of all definitely. Everyone at work, all my colleagues are exhausted, everyone's fed up and needs a long vacation. And, all the other patients are, we're still in catch-up mode for surgeries, for, hips and hearts and cancers and so on. We're still in catch-up mode. Will the healthcare system collapse? No, but will people with cancer and heart problems get shortchanged? Yes. Again, that's the trade-off, because that's what happened with COVID. Some people just didn't come, but people who needed a new this or a new hip or a new heart or a new heart valve or whatever, they had to wait. They had to wait another year or 2. That's a long time. So that will continue.
Thank you so much. Is there anything that I didn't ask that you'd like to share or touch on?
Well, I think the only other thing is just, we've been, early on in the epidemic, we were very aware of the supply chain problem. So, we couldn't do tests, we couldn't get masks, we couldn't get all these other things because the whole world needed them. And we've frankly turned usually to China or sometimes to Europe or to the US. And so, we need to be a little more strategic in terms of self-sufficiency and what's key. Otherwise, we'll be having the same shortages a month or 2 from now.